I'm Dr. Lydia here at Vibrant Life Direct Care, and I want to explain our Vibrant Rejuvenation Shot for women. Have you had trouble holding your urine when you cough, sneeze, or jump up and down? Or have you ever wished that your orgasms might be easier to obtain and last a little longer? Well, that's what the Vibrant Rejuvenation Shot for women does. I had to quit CrossFit about 6 years ago because I couldn't do the jumping exercises. I would almost completely saturate a maxi pad, and so I had to quit. But I was fortunate enough to be injected with platelet-rich plasma, which has allowed me to go back to CrossFit and do all the jumping that I'd like to do. So let me explain the procedure. The other indications other than sexual enhancement, non-invasive treatment for incontinence, and then also interstitial cystitis, which is an inflammation of the urethra and the bladder that causes painful urination and frequency. The procedure itself is based off of platelet-rich plasma, and I will explain that really quickly. So if you're familiar with having your blood drawn for regular lab, the plasma portion of the blood is what happens after we put the initial whole blood specimen into a centrifuge and separate the red blood cells from the liquid portion of the blood. This is the plasma, okay? This contains all of the healing properties of the blood that allows wounds to heal, okay? We take this portion, put it into our FDA-approved centrifuge, and we spin that down to the plasma portion, or take the plasma portion and further concentrate it. We actually take the topmost portion off and leave the bottom, and this contains white blood cells, platelets, and other growth factors in concentrate, and that's what we reconstitute to inject, in this case, the clitoris and the top portion of the vagina, okay? You would probably think that that would hurt quite a bit, but of all of our PRP procedures, the rejuvenation shot for women is the least painful. And that's because we go to great pains to make sure that this is very comfortable for you. First of all, we go ahead and apply a topical numbing cream to the outside and just to the top of the vagina where we're going to make the injection, and we allow that to set as we draw your blood and then process the specimen. Secondly, we come back and we use ice at the clitoral hood, and we numb the area there, and then we apply a lidocaine block to the clitoris. After we are assured that you are comfortable, which most women don't even feel that injection at all, we come back and we apply the vagina injection, and then we come back and do the clitoral injection. Most of the time it feels just like you might need to pee, but there's no burning, okay? So after we do the procedure, we allow you to wipe off with a baby wipe because we want to remove the topical anesthetic, and then we have you go urinate, and then you're ready to go. There is a little bit of soreness the first day, but otherwise the recovery time is very quick. With every platelet-rich plasma injection, we anticipate what's called the rules of 3 for regeneration. The first 3 days, the volume will still be in there. That means the amount of liquid that I injected in will have to dissipate. And after 30 days, you'll probably start to notice effects. I noticed effects with incontinence within a month. I could already do power jacks at my house and not leak urine. And then within 90 days, you'll start seeing maximal effects with enhanced orgasms, easier to achieve longer orgasms, and better control of continence of urine with coughing, sneezing, jumping up and down. So if this is a procedure that you would like to ask about or find out more about, please call our office and we'd be happy to have a free consultation with you. Thanks.